Bones are the silent guardians of our body, providing structure, support, and protection to our vital organs. Without bones, our bodies would lack shape and stability, making even the simplest movements impossible. They form the framework that allows us to stand tall, walk, and perform everyday activities with ease. Did you know that the human skeleton is a dynamic and living organ system? Far from being just a rigid structure, our bones are alive, constantly adapting to the demands we place on them. It is constantly renewing itself through a process called bone remodeling. This process is essential for repairing microdamages that occur from daily activities and for keeping our bones strong and resilient. This involves old bone tissue being broken down and replaced by new bone tissue. Specialized cells called osteoclasts remove old bone, while osteoblasts build new bone in its place, ensuring a healthy balance. This incredible ability to regenerate is crucial for maintaining strong and healthy bones throughout our lives. It helps us recover from minor injuries and adapt to changes in our activity levels, whether we're young and active or aging gracefully. However, there are times when bones face significant challenges in healing, such as severe fractures, bone infections, or bone loss due to diseases. These situations can overwhelm the body's natural repair mechanisms. In these cases, the natural healing process may not be sufficient. Without additional help, bones may struggle to heal properly, leading to long-term complications or loss of function. That's where bone grafting comes in as a remarkable medical procedure that aids in bone regeneration. Bone grafts provide a scaffold for new bone to grow, helping to bridge gaps and restore strength. Think of bone grafting as providing a helping hand to your body's natural healing process. It can make the difference between a slow, incomplete recovery and a return to full strength and mobility. It's like giving your bones the extra support they need to heal stronger and faster, allowing people to regain their independence and enjoy life to the fullest once again. Our bodies are incredibly resilient, and bones are particularly adept at healing themselves. When a bone fractures, the body initiates a complex cascade of events to repair the damage. Blood clots form at the fracture site, followed by the formation of a soft callus that gradually hardens into new bone. However, certain situations can hinder this natural healing process. Large bone defects, infections, and underlying medical conditions can all pose challenges to bone regeneration. This is where bone grafting steps in to bridge the gap and facilitate healing. Imagine a bridge being built over a river. The bridge provides a stable structure for people to cross. Similarly, a bone graft acts as a bridge or scaffold, providing a framework for new bone to grow. Bone grafting is a surgical procedure that involves transplanting bone tissue to repair or rebuild damaged or missing bones, restoring both structure and function. It's like giving your body a helping hand to encourage new bone growth in areas where it's needed most, supporting the natural healing process. Bone grafting is often recommended when the body is unable to heal a bone defect on its own, even with time and care. This could be due to large bone defects when a significant portion of bone is missing, such as in a severe fracture or after bone tumor removal, making natural healing difficult. Infections can damage bone tissue and hinder healing, sometimes requiring additional intervention. Sometimes a fracture fails to heal properly, resulting in a non-union, which can be painful and limit movement. Just like there are different types of building materials for houses, there are also a variety of materials that surgeons can use to help your body grow new bone. When a bone is damaged or missing, doctors need to choose the best way to rebuild it, much like a builder selects the right materials for a strong, lasting structure. In medicine, these materials are called bone grafts, and there are several different types, each with its own advantages and uses. The choice of graft depends on factors like the size of the defect, how much bone needs to be replaced, and how complex the repair will be. The location of the graft is also important, since some bones bear more weight or move more than others. And of course, the patient's overall health, age, and medical history all play a role in the decision. One common option is the autograft, which uses your own bone tissue to repair the damaged area. Surgeons typically take this bone from your hip, which is a rich source of healthy bone cells and growth factors. Sometimes, bone can also be taken from your leg or ribs, depending on what's needed and what's safest for you. It's a bit like borrowing bricks or wood from one part of your house to fix another. Using your own materials ensures a perfect match. Autografts are often preferred because they carry the lowest risk of rejection, since your body recognizes its own tissue. They also have excellent healing potential, helping new bone grow strong and healthy. Another option is the allograft, which comes from carefully screened and processed cadaver bone donated by another person. These donor bones are treated to remove any living cells, which helps prevent your immune system from rejecting the graft. The processing also reduces the risk of disease transmission, making allografts a safe and reliable choice for many patients. Think of it as using reclaimed wood from a trusted source to build something new. It's not from your own house, but it's been made safe and ready to use. Allografts offer convenience, and they eliminate the need for a second surgical site, which can mean less pain and a quicker recovery for you. There are also synthetic grafts, which are made from man-made materials like calcium phosphate or bioactive glass. These materials are designed to mimic the structure and properties of natural bone, encouraging your body to grow new bone around them. Imagine using specially engineered bricks that fit perfectly with your existing wall. Synthetic grafts are biocompatible, and over time they gradually dissolve as your own bone takes over, leaving behind a strong, natural repair. Let's walk through a typical bone grafting procedure together. It might sound complex, but understanding the steps can make the process less daunting. First, you'll receive anesthesia to ensure your comfort throughout the procedure. Next, the surgeon will make an incision near the area where the bone graft is needed. The surgeon will then prepare the area where the graft will be placed, making sure it's clean and ready for bone healing. After that, the bone graft material, whether it's an autograft, allograft, or synthetic graft, will be carefully placed into the bone defect. The graft will be secured in place using screws, plates, or other fixation devices. Think of these as internal scaffolding that provides stability while the new bone grows. Finally, the incision will be closed with sutures, and a sterile dressing will be applied. Bone grafting has a wide range of important applications in both medicine and dentistry, making it a crucial procedure for many patients. Here are some of the most common situations where bone grafting plays a truly vital role in patient care. Bone grafting can help heal complex fractures, especially those with significant bone loss or those that have failed to heal properly over time. In spinal fusion surgery, bone grafts are used to fuse vertebrae together, stabilizing the spine and relieving pain for patients. Bone grafting is often necessary to create a solid foundation for dental implants, replacing missing teeth and restoring healthy, confident smiles. And bone grafting can help rebuild bone that has been damaged by infection, giving patients a chance at better recovery. After your bone grafting procedure, your body will embark on an incredible journey of healing and regeneration. The bone graft acts as a scaffold, providing a framework for new bone cells to grow and integrate with your existing bone. Over time, the graft will be gradually replaced by your own bone tissue. This process, known as osseointegration, is essential for long-term success. New blood vessels will form, growing into the graft and supplying it with the nutrients and oxygen it needs to thrive. Specialized cells called osteoblasts will migrate to the graft site and begin laying down new bone matrix. The initial graft is gradually remodeled and replaced by your own bone tissue, resulting in a strong and integrated bone structure. Preparing for any surgical procedure can bring about a mix of emotions. It's completely normal to feel anxious, curious, or even a little overwhelmed as you anticipate what's ahead. Surgery is a significant event, and understanding the process can help ease your mind and give you a sense of control. Let's break down what you can expect before, during, and after your bone grafting surgery, so you feel informed and empowered every step of the way. Knowing what lies ahead can help you prepare both mentally and physically, making the experience less daunting and more manageable. Before surgery, your healthcare team will conduct a thorough medical evaluation to assess your overall health and suitability for surgery. This may include reviewing your medical history, performing physical exams, and ordering blood tests or imaging studies to ensure you're ready for the procedure. You'll receive instructions regarding any medications you should stop or continue taking before surgery. Some medications, such as blood thinners, may need to be paused to reduce the risk of bleeding, while others might be essential to continue. Always clarify any questions you have with your doctor or nurse. You'll also be asked to fast for a certain period before surgery, typically after midnight the night before. This is important to ensure your stomach is empty, which helps prevent complications with anesthesia. Your care team will give you specific instructions about when to stop eating and drinking. During surgery, you'll receive anesthesia to ensure your comfort throughout the procedure, and your vital signs will be closely monitored throughout the surgery. The surgical team will work together to keep you safe, making adjustments as needed to maintain your well-being. After surgery, you'll spend a short time in the recovery room where nurses will monitor your progress. They'll check your vital signs, make sure you're waking up safely from anesthesia, and address any immediate needs or concerns you may have. You'll receive pain medication to manage any discomfort, and you'll likely have some activity restrictions to allow for proper healing. Your care team will explain how to care for your surgical site, what symptoms to watch for, and when you can gradually return to your normal activities. It's important to follow your doctor's instructions carefully. This includes taking medications as prescribed, keeping your wound clean and dry, and attending all scheduled follow-up appointments. Adhering to these guidelines can help prevent complications and promote a smooth recovery. You'll also have follow-up appointments to monitor your progress and address any concerns. These visits are a chance to ask questions, discuss your healing, and ensure that your bone graft is integrating as expected. While bone grafting offers significant benefits, it's important to be aware of potential risks, which can include infection, pain at the graft or donor site, nerve damage, and graft failure. Your doctor will discuss these risks with you and answer any questions you may have so you can make an informed decision. Your medical team will take steps to minimize these risks. This includes using sterile techniques, carefully monitoring your condition, and providing you with detailed instructions for aftercare. Their goal is to support your recovery and help you achieve the best possible outcome. Bone grafting is a testament to the ingenuity of modern medicine, providing hope and healing to countless individuals. With the right preparation, support, and follow-up care, you can look forward to a successful recovery and a brighter, healthier future.